Medical Coding Fundamentals, Chapter 2, Introduction to ICD-9-CM. So what is ICD-9-CM? This is the International Classification of Disease, 9th Revision, Clinical Modification. Its purpose is to facilitate payments for services, track diseases, and associated healthcare usage, advances research, and aids in the patient care. ICD-9-CM consists of 3 volumes. Volume 1 is the tabular list of disease. Volume 2 is the alphabetic index of disease. And Volume 3 are the procedure codes. Each of these volumes are divided into chapters, tables, and appendices. When determining the diagnosis codes, it is essential that both volumes 1 and 2 be used together to find the correct code. The alphabetic index is used first, and then cross-reference the code with the tabular list. Volume 2 is the alphabetic index. The alphabetic index includes Section 1 for hypertension and neoplasm tables. Section 2 has a table of drugs and chemicals. And Section 3 has alphabetic index to external causes of injury and poisoning. Volume 1 is a tabular list of diseases, and it consists of disease classifications by etiology or anatomical site, supplementary classifications, which are V codes and E codes, and appendices. The first part of Volume 1 is divided into 17 chapters, containing categories and subcategories. Now, your categories are your 3-digit codes. Subcategory is your 4th or 5th digit. The second part describes supplemental classifications, which are V codes and E codes. V codes are classifications of factors influencing health status and contact with health services. And E codes are classifications of external causes of injury and poisoning. The third part includes appendices. Appendix A is for the morphology of neoplasms. Appendix C is used for the classification of drugs. Appendix D is for the classification of industrial accidents according to the agencies. And Appendix E is a list of 3-digit categories. Volume 3 consists of procedure codes. This volume is only used in the hospital settings, so we will not be coding from this volume in this class. Conventions. Conventions include abbreviations such as NEC, not elsewhere classifiable. This means that the documentation indicates that there was a specific diagnosis, but the listed codes do not identify that diagnosis. Or NOS, not otherwise specified, which are codes that are used when documentation does not support a more specific code. Punctuation. Brackets. Brackets enclose synonyms, alternate wording, or explanatory phrases that may be useful in identifying the correct diagnosis code associated with a condition. If you see italicized brackets, they are there to indicate that a separate code included within the italicized bracket must be listed as an associated manifestation. Parentheses are used to indicate that the enclosed words may be either present or absent in the description of a condition without affecting the code used to designate that diagnosis. And colons are used afterwards after an incomplete term to indicate that one or more of the modifiers following the colon is necessary to assign that code. Instructional notations includes. This means the conditions following this notation are included in that category. Excludes notations means that the condition following the notation are not described by that code, but other codes must be used to designate their condition. Use additional code instruction. This is used in the tabular list to indicate that the code is not sufficient enough on its own to describe the diagnosis, so the coder will need to use additional codes. Code first underlining disease instruction. This indicates that the code describes a manifestation that cannot be used as the first listed diagnosis. Update notations. You may see a bullet in the tabular list and it will indicate a new category or subcategory code. A triangle symbol indicates that the category was category, subcategory, or code has been revised. The word text means newly added text is indicated within the underlying. And if you see text that is marked out, has a line through it, it means newly deleted text was indicated through the strike-through. Additional digit specificity indicator. When a fourth, fifth, or fifth symbol appears with a 3 or 4 digit code, an additional digit is necessary to designate a more specific code. The diagnostic code, specific color highlights. If you see a blue background, this describes the manifestation as an underlying disease, but not the disease itself. If there's a red background, it describes circumstances that influence the individual's health but are not a current illness or injury. Age conflict edits. If you see an N, this is for newborn. This is 0 years of age, newborns and neonates only. A P is used for pediatric, which would be 0 through 17 years of age. M for maternity. This will be between 12 and 55 years of age. And A, adult, for 15 years of age and older. There's also sex conflict edits. So you have these codes are only indicated for one gender. So you may see these symbols for the male and the female. And hospital-acquired conditions are HAC indicators. These are conditions that were not present on admission. You'll see an H printed on the light blue background. Other and unspecified codes indicate with an 8 as the fourth or fifth digit, an 8th as the fourth digit, or a 9 as the fifth digit. Now these are used when there is enough information to indicate the specific diagnosis is, but there is no other code available for describing that diagnosis. C and C also instructions. C is another term, means that there is another term that should be utilized to identify the correct diagnosis code. C also is giving you a choice, saying that there's another term that may be referenced for additional information, but it's not necessary to do so. Signs and symptoms. A sign is an objective evidence of disease. Symptom, subjective manifestation of disease. Signs and symptoms are used only when a specific diagnosis has not yet been established. Combination codes are a single code that designates two diagnoses combined with one or more manifestations, or a single diagnosis with an associated complication. Outpatient coding principles. Reporting professional services provided in offices, outpatient hospital settings, and inpatient hospital settings. The major reason for service is reported first. Signs and symptoms are reported when specific diagnosis is not available. Diagnosis codes may have 3, 4, or 5 digits. Encounters that occur for reasons other than the diagnosis or treatment of illness or injury are reported using V codes. Okay, your homework for this chapter is to read Chapter 2, do the using terminology on pages 48 through 49, checking your understanding, page 49 through 52, and study for Chapter 1 exam. See you next week.